it was very controversial that the Affordable Care Act sought to expand insurance coverage, controversial politically. The parties disagreed on whether and how to do that. But largely uncovered in the media was the fact that about half of the Affordable Care Act dealt with payment and healthcare payment and delivery system reform so that we could move, at least in part, away from a total fee-for-service system toward one in which value-based payment would allow providers to better coordinate and get paid for the value, meaning better health, better care, and lower costs of their services.
The shift towards value-based payment is impacting plans and providers in many ways. State laws are changing very rapidly, as are the federal laws, to accommodate the different types of payment arrangements. So one example is in New York State, Medicaid payments, which it's all managed care right now, are required to be 80 to 90% of them are required to be value-based payment by 2018. So that's causing an awful lot of change for both providers and plans, and it has a trickle effect into commercial and Medicare Advantage as well.
We certainly see that it's very likely that the program will follow through on the promise of reducing program expenditures, but will value-based payment arrangements succeed also in delivering the promise of improved clinical outcomes for patients and improved quality? That's going to be very difficult to measure, particularly as quality measures currently are very limited for patient outcomes. Secondly, if those quality measures for outcomes emerge, will we find that providers have been able to deliver better outcomes for patients for less program expenditures?
Some of the changes that I've seen in organizations as a result of the shift to value-based payment include provider organizations needing to involve more constituencies than just finance in those arrangements. So they need to bring in more, I think, from the clinical departments as well as the IT departments. Good data is critical when you're trying to manage a value-based payment arrangement. You need great clinical data, you need to understand the costs involved, so they play a much bigger role than they would have in the traditional fee-for-service type of arrangement.
For commercial payers and Medicare Advantage plans, the shift to value-based payments means that plans are very sensitive to inadequacies in the Medicare risk adjustment payment system. So the payment system does require plans to code and report, and they do receive reimbursement support for the underlying chronic conditions of their patient population. However, plans have been seeing increasingly over the last few years that their patient populations that might have poorer socioeconomic factors perform more poorly on quality measures. And so plans are seeing the need for a federal update to risk adjustment systems in the Medicare Advantage program to appropriately recognize the impact on outcomes of socioeconomic factors in addition to chronic diseases.
There's no one right way to go about this. We will see a mixture. I think the role of payers is changing some. In many cases, they're operating more as an information system company to provide data and help coordinate the care, if not providing the insurance. I think both payers and providers will be in the mix for the foreseeable future, and I think there's a tremendous opportunity for them to collaborate.
I'm anticipating increased consolidation will continue, both on the plan side and the provider side. And in that consolidation, I think we'll see vertical integration as well as horizontal integration. And a lot of plans are putting on provider hats, and a lot of providers are setting up health plans. So those lines are very much blurring.
It's very challenging to take a complex, high-tech healthcare delivery system and change the whole motivation, the whole recognition for what is deemed to be good care and payment for that. To change it, you can't do it overnight, and we're working at it, and we remain, in a testing period that will be ongoing.